Welcome to Nothing Without Us, stories and discussions about meaningful inclusion. We will talk about accessibility, true inclusion, and disability justice with stories, policy updates, discussions, and related commentary on the value of being accessible and inclusive. We believe life should be accessible for everyone, and everyone should be included in all aspects of life. I am your host, Annette Bourbonniere. I am a 70-ish-year-old woman with short gray hair and eyeglasses. I am sitting in a power wheelchair, and my service dog Kirby could show himself at some point during the podcast. This podcast is captioned. Please press the subscribe button at any time during the podcast if you have not already done so. It will not cost you anything, but it will help us make this podcast grow. You are also welcome to make comments in the chat and to give us feedback about what you do or do not like. We especially appreciate a thumbs up. Hi. On June 22nd, 2024, we observed the 25th anniversary of the Olmstead decision. So you might want to know, what is the Olmstead decision about? It's about least restrictive setting. It's about community inclusion. It's about competitive employment. The case that started it was in Georgia, where two women with mental illness and intellectual and developmental disabilities were voluntarily treated in a hospital. When their treatment was completed and physicians said they could be discharged back into their communities, they remained held at the hospital. So the suit went all the way up to the Supreme Court, and this decision was upheld by the U.S. Supreme Court on June 22nd, 1999. Since then, 29 states have issued an Olmstead plan. Of these 29 states, 20 of them published their plans between the years 2000 and 2002. Seems they were right on this. And the other 9 states published theirs in 2003. Sadly, Rhode Island is not on the list. So the Olmstead decision is related to the Americans with Disabilities Act, and it is related to the fact the ADA says people cannot be discriminated against based on disability, that they need to be able to live in their communities in an integrated setting. So this was denied these women, and it's denied to a lot of people. So in 2014, the United States Department of Justice and the state of Rhode Island entered into a consent agreement to resolve violations of Rhode Island with respect to the statewide day activity service system for individuals with intellectual and developmental disabilities. Also, a violation of the Americans with Disabilities Act and a violation of the Olmstead decision part of the act. And here's a little story of somebody that I knew. I do know several people who have worked in these sheltered workshops. The day activity system they were talking about really involved sheltered workshops where people with disabilities would be employed there and paid way much less than the minimum wage. And this work in the sheltered workshops was never used as a step or as a training for them to apply these skills in a competitive employment situation. They were there for the long haul, for sure. And so I knew one woman, I knew several people, but there's one that really sticks in my mind when I think about whether or not people can go from sheltered workshops to competitive employment. And I coordinated an action club for people in the local area. And one of our activities, and I don't remember part of the activity, you'll have to forgive me for that, but what we were doing was preparing baskets. And whether they were baskets to donate or baskets to be raffled as a fundraiser is the detail I don't remember. But we had all this stuff that had been donated that we were putting into these baskets, and we were lining them up, and I was trying to explain to people what to do. And this woman who had worked in the sheltered workshops, came up to me and said, "That's not how you do it." So I said, "Okay, you want to show me?" And she said, "Sure." And she said, "You put this here, and you put it in this order and this way, and a person can come and do this, this, and this, and fill the baskets." Well, in fact, what she set up was way more efficient than anything I was doing. And my thought immediately went to, she could run an assembly line in some capacity. She had the skill. And so this is part of what that whole consent decree was about, was that the people that had worked in these workshops should have been given the opportunity to apply these skills that they've learned there to other employment. So under the consent decree, people were gradually moved out of the workshops into integrated competitive employment, and at being paid at least minimum wage. They also, it was a slow transition because they needed to be given the supports that they needed to do it, but this was part of the consent decree. There were also transition services set up for people going from high school into adulthood. And again, it was an issue of, finding a way that helps them be more active in their communities, in employment with other people, not necessarily disabled. And the supports that they needed to make that happen were part of this decision. Now, as of today, Rhode Island still does not have an Olmstead plan. And so I would think that after this incident where we had that consent decree, that this should happen. The Rhode Island Senate passed a bill that was authored by a significant disability ally, Senator Lou DePalma, and this bill was to establish an Olmstead Plan Commission. And so what would be the plan? What is the commission supposed to do? And first of all, as far as this bill goes, one of the requirements of this commission is that its work include significant substantial input from the disability community and from the community at large. And I think this is really important because I can tell you from experience, when government or policymakers try to set something up for people with disabilities without conferring and without really taking into account substantial input, it doesn't necessarily work in our best interest. So this is a really important part of it. So the first thing that the commission is going to have to do is look at the infrastructure that is needed to support a plan. And this infrastructure includes things like transportation, housing, rehabilitation, medical services, and the supports needed for integrated employment. And this is going to be a challenge because Rhode Island's transportation is, well, let's just say less than adequate. We do not have a good transportation system at all. We have a housing crisis, as many areas do. Our rehabilitation services and human services have been short-staffed for some time, and and healthcare is a challenge now as well. So this is going to be really hard. They're going to have to identify what needs to be done. They'll have to look then for funding, whether it's federal, state, or a combination, to create the changes that need to be made, and then start making them, implemented it. And every 5 years, this commission will be required to review and update the plan. And I think this is really important, because that is another problem that happens where you have a good program, a good plan, and it's great then, but it may stay great for 50 years. It may just stay in existence for 50 years without any adaptation to the changes in society. So this is really good. Again, I really thank Senator DePalma and Senator Saccone for introducing this legislation. So the Americans with Disabilities Act is going to celebrate its 34th anniversary this year, and the Olmstead decision marks its 25th anniversary this month. It has taken a very long time for people in this country to recognize the value of supporting people with disabilities in our choices, in our employment, in our education, in accessibility to all that other Americans have access to. From a purely economic perspective, supporting the freedom of persons with disabilities to live our lives fully is an investment rather than a cost. When people with disabilities are given the freedom to live independently, receive the education we deserve, and to work to our fullest capacity in our chosen field, earn legitimate incomes, we earn money that then allows us to pay taxes, to buy goods and services, causing other people to be employed and pay taxes and buy goods and services, etc. So paying for institutionalization and limiting the income of people with disabilities is much more costly. So who benefits from that? If you have that answer, please let me know. I'm Annette Bourbonniere from Nothing Without Us, Stories and Discussions of Meaningful Inclusion. Please check in soon for upcoming episodes. We are just beginning the sub-series of Crip the Vote, and we will be talking about Disability Pride Month and the 34th anniversary of the ADA, and a number of other issues in the near future. Please visit us on patreon.com, where you will find that all our episodes, in case you've missed any. You can also find me on YouTube, LinkedIn, Instagram, and Threads. Please remember to hit that subscribe button and give us a thumbs up. That's going to help us. The more subscribers we have, the easier it's going to be to get other speakers and guests to provide the best program for you. So tell all your friends. Let's help make this podcast grow. My goal is that we'll hit 1,000 listeners by the end of this summer, and if you leave comments, I will surely check on them. Until my next episode, this is Annette Bourbonniere.